Welcome to day 4 of Rethink, Reshape, Reimagine. I'm Tetay Mendoza, and this is Public Health, Public Safety, Why Not Both? For the last 3 days, we have been rethinking, reshaping, reimagining our notions about drugs, people who use drugs, and our drug policies, specifically asking for our context. How do we involve the law enforcement in the conversation? Where do we begin? Our speaker for today worked at the Public Defender Association in Seattle, where he served as program director, director of harm reduction practices, and national support director of the United States' first law enforcement assisted diversion, now known as the Let Everyone Advance to Dignity, or the LEAD program. He brings his expertise in program design, implementation and evaluation, and qualitative research methods and practice. Everyone, please welcome a pioneer, a friend, and a hero to us all in the harm reduction advocacy, Kris Nyrop.
Thank you for allowing me the opportunity to speak with you today. What I will be talking to you about is a unique collaborative partnership called Law Enforcement Assisted Diversion, or LEAD for short. LEAD began as a pilot project in the U.S. city of Seattle back in October of 2011. I will be covering 5 key points in this talk. First, the fundamental importance and benefits of collaborative efforts between individuals and groups who may not initially agree with each other or even trust each other. Second, how and why LEAD came about in Seattle. Third, what we have learned in the process of doing it. Fourth, LEAD replication in other areas. And finally, the special nature of the LEAD service delivery model and the importance of harm reduction to that model. To get started, LEAD is a cross-disciplinary, cross-sectorial collaboration involving police, prosecutors, business owners, residents, and community-based service providers. It is an effort to bridge the gap between public health approaches and traditional criminal justice system responses to public safety. It addresses public safety by using public health approaches and emphasizes the importance of using pragmatic and practical strategies that are rooted in harm reduction. I will explain what that looks like in practice in just a little bit. Bringing this collaboration into being was not easy. We used to joke that the only time many of us spoke to each other was when we were in court arguing in front of a judge. But for over 10 years now, we have committed to working together as a team to address the genuine public safety challenges posed by illegal drug use and other nonviolent crimes that are due to behavioral health conditions such as substance use and/or mental illness. I mentioned before the question of trust. When we started work on this collaborative effort, there was considerable mistrust among some of our partners. Some of the community members had long been very critical of the police and had engaged in courtroom-based litigation. So the police were skeptical that these community members would collaborate in good faith. And some civil society groups were skeptical that the police would implement the program and follow it in good faith. So one of the first things we agreed on was that we would treat each other with respect. Second, we agreed to focus on the areas where we were in agreement and that we would leave the things we disagreed about at the door. And one of the things that we discovered was that the more we treated each other with mutual respect and the more that we focused on areas of common agreement, the more we came to trust each other and the easier it became to work on those areas where we had initially disagreed. This brought about a profound shift in how we approached difficult social problems. We ended up having police officers and civil society groups advocating together for improved access to substance use treatment and mental health services, and police officers saying that they were not the most appropriate responders to individuals with behavioral health issues. How did this collaboration come about? Quite simply, we were completely and utterly exhausted from all of our arguing. We had been doing it for over 10 years. And we all acknowledged that what we had been doing for decades was not working. And we made a commitment to work together to see if we could find a better way of addressing problems that everyone agreed were affecting the quality of life in Seattle. The traditional approach did not work for police. No matter how many drug users the police arrested, there was still drug use. And the police themselves were saying, we cannot arrest our way out of this problem. It was not working for prosecutors. They could get very long prison sentences for large numbers of people, and still there was drug use. In fact, we had drug use inside the prison. In Washington State, where Seattle is, we were routinely sentencing people for up to 10 years in prison simply for possessing very small amounts of drugs. At one point, over 25% of all inmates in our state were in prison for drug offenses alone, no other offense. It wasn't working for business owners and residents because they kept paying more and more for taxes, for police, prosecutors, and the jail and prison. And families and communities were being ripped apart. And it certainly wasn't working for the individuals who were being arrested and sent to jail. Everyone agreed that that approach only made things worse for them. Once we all agreed that what we had been doing was not working, we agreed to try something different. And at that point, we asked three fundamental questions. First, what if we could make arrest the strategy of last resort for low-level drug offenses in Seattle? Second, what if we could change what is almost always a bad encounter between police and those getting arrested and change it into something positive? Positive for the police, the individual, and for the community as a whole. And third, could this approach give us better outcomes and cost less than what we're doing now? After 10 years, I can tell you that the answer to these three questions is an unequivocal, resounding yes. It was such a yes that even before we had any evaluation results, the City of Seattle and the Seattle Police Department expanded the program and has continued expanding it ever since. For example, I mentioned that we began as a pilot project. We began by focusing on one small neighborhood in Seattle with a small group of about 25 police officers. After just a year, people in neighborhoods adjacent to the neighborhood where the pilot was happening went to the mayor and the city council and asked, why does Belltown have lead and our neighborhood doesn't? They put so much pressure on them that the city funded an expansion of lead. As I said, we didn't have any evaluation results yet. In fact, we hadn't even started the evaluation. But folks in those neighborhoods could see the transformation that was taking place in Belltown, and they wanted some for their neighborhood. Also, other police officers began asking for the ability to participate. They wanted the ability to divert people into the program rather than arresting them and taking them to jail. Since its beginning as a pilot in 2011, LEAD has expanded citywide and is available 24 hours a day, 7 days a week. When we started, it was just one small neighborhood, a few days and evenings a week. And the program has been adopted and replicated by dozens of cities all across the United States, cities of widely differing size and demographics. For example, LEAD has been replicated in Los Angeles, which is the second largest city in the United States. It also has been implemented in other large cities, such as Philadelphia, but it has been also implemented in small cities, such as Santa Fe, New Mexico, which has a population of about 85,000, and even in some small rural jurisdictions. When we began, we didn't know if LEAD would work, but we all agreed to try it in good faith. If it didn't work, we could abandon it and try something else. But if it did work, we would all benefit from it. As an example of this uncertainty, the police captain who agreed to try this out told his officers, quote, "We don't know if this will work, but it will not fail because of the Seattle Police Department." He wanted his officers to operate in good faith so that if it did fail, they would not be blamed. This is a great example where you can operate in your own self-interest and still achieve collaboration and benefits for others. So what did we do? The first thing we did was agree on what criminal offenses would make a person eligible to be diverted into lead services. At the start, this was possession or sales of 3 grams or less of drugs or prostitution. The eligibility criteria have changed significantly over the years. The second thing we did was define what kinds of prior offenses might make a person ineligible to be diverted. When we started, we were fairly conservative, and people could be excluded for any prior violent offense and some other serious crimes. This has also changed dramatically over time. The third thing we did was agree that lead services would be rooted in harm reduction. We were very mindful of the fact that the needs of people being diverted were very likely to be many and to be complicated, and that if those needs were easy to fix, they probably would have been fixed already. We were also recognizing that substance use might not be the most important or first thing to address with those who were diverted, that people might have mental health issues or other underlying conditions that were important to address. We also recognized that poverty and inadequate or unsafe housing could be quite serious issues that would prevent people from engaging in treatment or other care. So we agreed there would be no one-size-fits-all care plan. Instead, caseworkers would meet individually with people who had been diverted and work with them to define what their needs and goals were. The fourth thing we did was meet with the frontline police officers and train them in the program and get their feedback. And then we asked them that when they otherwise might arrest someone for a lead eligible offense, that they call a caseworker who would show up on the spot. I can tell you that many of our officers were quite skeptical of this program at the start. I can also tell you that some of those who were most skeptical became the program's biggest champions and made the most diversions. Some of this skepticism was overcome almost immediately. For example, the first night we began lead in Seattle, the officer who made the very first arrest for a lead eligible offense had been one of the most outspokenly skeptical of the program. But she recognized the individual, and when she ran a records check on him, she saw that he had 56 prior arrests, all for very low-level, non-violent offenses. She said later that she thought about it and said to herself, I don't think 57 is going to make a difference. So she decided to divert him and called a caseworker who came to the scene and dealt with the individual right there. Years later, he's been stably housed, quit using drugs, and has been employed. And over time, the police themselves began to ask for changes in the program. The first change they asked for was the ability to divert someone who had not committed a crime, but who might benefit from the program. So we did that, and we call that a social contact diversion, as opposed to an arrest-based diversion, which is what we started with. Today, almost all of our diversions in Seattle come through social contacts. The police are out on the streets every day. They know the communities they work in, and they know who is struggling with substance use or mental health issues. And they know that they have a tool other than arrest, a tool that works better than arrest. Why would you use a hammer on a screw? A screwdriver works much better for that purpose. The second thing they said was that we had been too conservative in our eligibility criteria, and we should expand it. And so we did. As I said before, when we first began in Seattle, the only lead eligible offenses were possession or sales of 3 grams or less of drugs or prostitution. Now, it's almost any nonviolent offense that is attributable to substance use, mental health issues, or poverty. I also mentioned before that the answer to our original 3 questions was yes. And we know this not just through our own personal experience, but because LEAD has been independently evaluated by outside experts. And they found that people diverted to LEAD were 58% less likely to be rearrested on brand new offenses, new charges, than control group members who were not diverted. So we got great outcomes on recidivism. They also found that LEAD was less expensive than the criminal justice system as usual, and that clients were very happy with the program. LEAD has also been evaluated in 6 other areas, and they have all found similar results. Let me give you a concrete example of what recidivism can look like for the police, the prosecutors, and individuals. Santa Fe, New Mexico was the second US city to implement LEAD. And the Santa Fe police, when they talk about the benefits of LEAD, they point to the second person they diverted to LEAD. She was arrested less in the 2 years after she was diverted than she was in the 2 months before she was diverted. So yes, she was rearrested, but less in 24 months than in 2. They saw this as a clear win. Let me also give you an example of cost. Albany, New York was the 3rd city to implement LEAD. The first individual who was diverted there was a gentleman with a serious underlying chronic and life-threatening medical condition. He was also an individual with both substance use and mental health issues. So for years, he had been in a cycle of getting taken to the emergency room, being in the hospital until he was stabilized, being discharged back into the same situation, and then a week or 2 later, he would be back at the emergency room. After he was diverted to LEAD, he had a caseworker who would take him for healthcare appointments at a neighborhood clinic, who ensured that he got and took his medications, and worked with him on his substance use and mental health issues. The city of Albany calculated that the emergency room savings from this one individual almost paid for the entire program in its first year. I mentioned before that LEAD has been widely replicated. It has now been funded at the state level in at least 4 US states and also at the federal level. One of the fundamental questions raised by LEAD is the effectiveness of having police be the primary responders to people with behavioral health issues. And several US cities have realized that it's very ineffective, and so are partnering more and more with civil society groups to have them be the ones to respond to people who have violated the law due to substance use or mental health. And this is really important. Even if they don't do LEAD or other types of diversion, they are having the police step away from a wide array of nonviolent offenses and letting those with public health expertise handle the situation. I have mentioned that the LEAD service delivery model is rooted in harm reduction. And before closing, I want to clarify what I'm talking about here. What people now refer to as harm reduction grew out of HIV and AIDS prevention efforts with people who used drugs in the mid-1980s. At that time, there was no effective treatment for HIV. And if someone got HIV, the trajectory was clear. They would progress to a clinical diagnosis of AIDS, and then they would die from opportunistic infections that were frequently horrific. Individuals working with drug users in a variety of countries argued that AIDS was a far more serious issue than substance use, and that individuals should be provided with the tools and resources they needed to help them avoid HIV infection. The primary examples of this were condoms to prevent sexual transmission, sterile syringes to avoid injection-related transmission, and more effective forms of substance use treatment. Since that beginning, harm reduction has developed into a set of pragmatic and practical strategies for working with individuals involved in behaviors that could endanger themselves or others. The fundamental premise of harm reduction is the notion of meeting people where they are at, both literally and figuratively, and working with them to reduce the harm of those behaviors. Harm reduction emphasizes that behavior change can be difficult, complicated, take time, and that in the meantime, it is important to protect a person's health and well-being. So to summarize, LEAD is a cross-sector collaborative effort to address public safety through harm reduction-based public tools. You define eligibility criteria, you define exclusionary criteria, you have officers divert individuals who are LEAD eligible. At the point where the officers would otherwise arrest someone, they call a caseworker who shows up on the scene for what we refer to as a warm handoff. Caseworkers provide individually tailored and appropriate services for as long as participants may need.